about kids, if kids have headaches when they're little, that's usually a sign it would probably be very wise of those parents to come and see you with that child and see if their jaw is creating the headaches, because most
Could possibly
likely
be creating a headache. Yeah,
with little ones.
I've seen a lot of very young children with what would be diagnosed neurologically as a migraine type headache. I've seen 6-year-olds that get up and go to school and they're somewhat lackadaisical or don't seem to have a lot of energy. They're subdued. Sometimes they go to school and they throw up in mid-morning. Maybe they had their breakfast or something. They get to school and they just have this headache. Well, children at that age don't know what a headache even is, especially if they've had it as long as they can remember.
True.
This is part of, so I guess this is part of being a human.
Yeah.
Like I got 2 legs and they work this way and I don't really think about it. My head hurts, but that's the way heads are, I guess. So that can be confusing diagnosis, and these children often end up, not that they may not need it for other medical conditions, but I've had children come in that are getting upper and lower GI examinations. They're looking at everything. They have files this thick, and what's wrong is their jaws are not growing properly.
Wow.
So they're having muscle dysfunction problems that are chronic, almost muscle spasms, if you will.
Yeah.
Not truly muscle spasms, but very high increased muscle tension.
Yes.
And so they're not able to rest their jaw muscles or muscles that surround their skull. So yeah, there's a lot of ways that these problems could be intercepted, and but part of the problem is the lack of training among dentists and physicians about these problems.
And with children, do you start them off if they need myofunctional therapy, and then do you see if that solves it, and if it doesn't, if they need the appliance that you do for kids on the bottom?
It's usually a combination of things,
Okay.
and they're usually stepped in some way. In other words, you can't just go in and affect everything all at once. For example, an appliance that stimulates growth is not an appliance that will necessarily stimulate widening of the upper arch. So they have to be done in stages. Now, myofunctional therapy, for example, is a great therapy. We use it here. It's absolutely essential to correct a lot of these problems, but it will not change the forward growth pattern. And that's really the deficiency. So a lot of focus is on expansion, as I mentioned earlier, which has a very minimal impact, truthfully, and high relapse over what's achieved. Most of those cases tend, no matter what the expansion was originally, they'll relapse down to about 2 millimeters ultimately.
Oh, wow.
And studies have shown that. So
Not very much. Yeah.
it's not very much in the end.
Yes.
And sometimes I see patients that come in, I have their previous records, and they had expansion, they come in, there's no change.
Wow.
By the time I see them, there's no evident change there. It's all relapsed back to where it was. So there's some issues about that. Again, I would stress, well, what are the main problems here? What's causing them now? And then with regard to changing tooth relationships and those kind of things, you don't start there just out of the box. That's not the whole answer.
Right.
The whole answer is more complex, and some other treatments have to be included, and they have to be included in a certain sequence for that patient, not for every patient.
Yeah. Everybody's unique. It sounds like to me you don't have a bunch of cases that are all the same.
I don't have any case that's the same.
Yeah, so maybe if you have somebody who's doing the same thing on everybody, that could be a first red flag. Just get a second opinion, because it's complicated,
Right.
as you can hear with the way our skulls are growing now, and it's happening with little babies. They're born this way, and airway issues.
They
And
just continue to grow.
yes,